Hello everyone, I am Dr. Srimathy Raman, one of the consultants in WMN group of doctors. Twin pregnancies are when you have more than one baby inside the womb. They are more common if you have become pregnant after the age of 30, if you have conceived with the help of IVF or fertility treatment. Of course, family history is also very important. Twins are either identical or non-identical, but in medical terms, we speak more in terms of what is called as chorionicity. This is based upon how they share the placenta or the afterbirths. Identical twins happen when one egg is fertilized by one sperm, forms one embryo, and then it splits into two. So they are of the same gender and they look identical. Non-identical twins happen when two different eggs are fertilized by two different sperms, forming two different embryos. So they are in essential siblings who are born together. Twins are definitely double joy, but they could be double trouble too. For the mother, they could have exaggerated symptoms of pregnancy, more vomiting, more tiredness, and moving forward, they could feel more abdominal distension and even swelling of the feet. But what we are more worried about is women carrying twin pregnancies are at risk of anemia, where the hemoglobin could drop. They are also at risk of developing hypertension during pregnancy, and many a time they may deliver early. So in order to prevent these issues and to monitor them in order to ensure good outcomes, they need to be closely supervised. In terms of the babies, as I told earlier, they may be born early. So it is important that delivery happens in a hospital where there are good NICU facilities. And twins also have special complications based upon whether they share their placenta or not. They need to be frequently monitored with scans, which could be either 2 weekly or up to 4 weekly based upon the chorionicity. That is, whether they are sharing the placenta, which is monochorionic twins, where we do the scans every 2 weeks because they are at risk of special complications. So it's important that you're cared for in a clinic where there are facilities for scans, and at WMN, we run a special clinic for twin pregnancies every week. Moving forward, in terms of delivery, it's important that you understand that you could have a normal delivery. Having twins doesn't equate to a cesarean section. Of course, cesarean section could be needed for various problems in the mother or in the babies. And it's also important to remember that there could be some problems at delivery, more so especially with bleeding. Once the babies are born, yes, it's important that you have good support because it's going to be a daunting task looking after both the babies. The next common query is whether they could breastfeed. Breastfeeding is possible with twins. Yes, you would need good family support, and with the help of a lactation consultant, you could definitely breastfeed the twins. So if you think you would want more information, or if you want to consult us, please visit us at WMN Clinic or one of the hospitals. And of course, follow our social media handles for further information. Thank you.